Next up, we have IMPALA, presented by Nick Verstichte.
Always difficult to present after such good presenters. Hope everybody's happy. I'm going to take you through my journey, starting with this picture. And in this picture, you see my 1-year-old son, Gus, playing with a 2-year-old boy called Nick. Nick Mandela was his full name. We called him Tanzanique. And he's the first boy who survived in the neonatal care unit that I started while working in Tanzania as a tropical doctor. And this moment captures the why of why we're standing here today and why we need to work together to make an impact. And I've seen it, unfortunately, also go wrong many times because as a doctor, I was running around like crazy, caught in a vicious cycle of reactive care because there was not enough staff and not the right equipment. And to address that challenge, we have developed the IMPALA patient monitoring solution, a robust, durable, easy-to-use monitoring device that can be used by health workers in the setting, but also an intuitive application to make sure that the data is translated into insights so health workers know who needs their attention at the right moment in time, breaking the vicious cycle of reactive care. However, technology is only an enabler of the change. People are driving the change, so that's why we have a human-centric service model in which you do a baseline assessment together with the local staff. We do an installation adapted to the context and provide the training that is needed for success. But also success doesn't end with the implementation. It's really about the service model that comes after that. How do you sustain it? So we have uptime services, making sure that the system remains up and running, that there's new software and data features, but most of all, that there's training and training materials so that health workers really have the skills and knowledge they need to use the system. Our results are off the charts. We see a 27 to 51% reduction in mortality. Over 90% of health workers report that after implementation, their workload has reduced. Last but not least, we see that the cost per patient are only $3, whereas the cost saved per patient is $39, reducing catastrophic health expenditure to vulnerable populations. And while this is really great, we believe it's only the start of things because we designed it to be a platform. By adapting the solution to different use cases, for example, to labor ward, integrating with other equipment, integrating a decision support and labor care guide, we adapt it to be better used, and we leverage the data to be unlocked at the local level, as well as the health system level, so that we can really drive change further, quality improvement, and health management decisions. We are on track to become standard of care and achieve a mind-blowing impact. We're now in 40 hospitals, achieving a $2 million revenue this year, growing to 110 hospitals next year. We have achieved national scale-up plans with the government of Malawi and Rwanda, whereby they commit to paying the service fees. And our projected impact by 2029 is 180,000 lives saved. And I'm not doing that alone, of course. We have a strong team with a strong local presence in each country where we work. We have strong partners working in these countries who know the health systems and help us navigate this. To end, I think this picture is the same two boys 8 years later. I think that's really what it's about. And 180,000 translated times this, that's unimaginable. We need NGOs, funders, who can help us scale and evolve the evolution further, adapted to different contexts, technology partners who can help us build the platform, and investors who can help us to come to the point of break even. Thank you all.